Oral manifest of syphilis. Definition: syphilis is an infectious disease caused by the bacterium Treponema pallidum. Syphilis has three clinical stages and may present various oral manifestations, mainly at the secondary stage. The disease mimics are more common on oral mucosal lesions, going undiagnosed and with the proper treatment despite the advancement in medicine toward prevention, diagnosis, and treatment. Syphilis remains a public health problem worldwide. Epidemiology: syphilis is an infectious disease caused by the thickly coated anaerobic filamentous bacteria Spirochetes treponema pallidum. Although cases may be transmitted from pregnant mother to child or through hematogenous fluid, the infection mainly is spread through direct contact with syphilitic lesions. This contact most often occurs during vaginal, anal, or oral sex.
The etiological agent of oral syphilis is the spirochete Treponema pallidum, Treponema of the family Spirochaeta, ordo Spirochaetlus. Treponema pallidum is spiral, gram-negative, with a length of 11 meter, with a diameter between 0.9 until 0.18 meter. Humans are the only known factor. Transmission occur via oral genital, oral anal, or the sexual contact, transfusion with contaminated blood, direct contact with contaminated materials, and intrauterine transmission, according Soares et al. 2004. Pathogenesis of oral syphilis. Oral syphilis in its course is divided into three stages, namely primary, secondary, and tertiary stage. 1. Primary syphilis. The initial lesions of syphilis are papules that appear in the genital area about 3 weeks after sexual contact. The papule enlarges to a size of 0.5 until 1.5 cm, and then the ulcer, forming an ulcer. 2. Secondary syphilis. Papules are usually red or reddish brown, discrete, 0.5 until 2 cm in diameter, generally scaly but sometimes smooth. And then 3. Tertiary stage syphilis. Skin lesions are usually solitary or multiple, circular or semicircular, destructive and chronic, healing contractly and extending to be periphery. Bone lesions are usually in the front of periodontitis, according Soares et al. 2004.
differential diagnosis. Clinical differential diagnosis of oral syphilis. The oral lesion of syphilis can be non-specific, and because syphilis may mimic a variety of other diseases, the different diagnosis is long. In genital, the directional diagnosis consists of lesion process which present ulcer, with a firm border of multifocal ulcer with pseudomembrane. Their entails include traumatic granulomas, ulcerative, atypical major aptose ulcerative, geographic tofu, fungal infection, histopathosis, plasmocystis, tuberculosis, squamous carcinoma, Crohn's disease, pigmatitis vigans, subepithelial vesiculosis disease, egg exposure ligand plantar, bronchiolite ulcer, or granulomatosis with polyangiitis.
Referral and spotting investigation. Referral. This initiated a laboratory examination for syphilis and a referral to a doctor for further treatment. Spotting investigation follow-up examination is divided into normal 1 micrological examination, 2 serology tests divided into types. Normal 1 non-treponemal tests that fall into this category are RTR and FDRL tests. Serological tests belonging to this group detect immunoglobulins, which are antibodies to the lipid materials of testatory T pallidum cells. And 2 specific treponemal tests that fall into this category are TPHI, TP-Rapid, TPPI, FTI-IPIs. Serological tests belonging to this group detect antibodies that are specific to treponemas. Pharmacological therapy and non-pharmacological therapy. 1. Pharmacological therapy. The drug that is the treatment of choice for syphilis until now is benzathine penicillin. But benzathine penicillin has the disadvantage that it causes pain at the time of injection, and there are some people who have an allergic reaction to penicillin. Some of the shortcomings of this penicillin that cause the need to look for other treatment alternatives that will not cause trauma and substitute drug if there is an allergy to the use of penicillin. 2. Non-pharmacological therapy. All syphilis patients should be treated by injection benzathine penicillin only. There is a story of allergy reaction